under the license, the founding team, there's 3 of us, had to submit to very comprehensive and expensive background checks. While I understand and obliged by those, I do have an issue with the fact that the founders then need to go through another expensive background check to actually be agents of the establishment. That totals roughly $600 per owner to actually work in the business. If we were able to pass the background check to receive a license, I believe we should be able to then work in the business that we applied for. One other thing I want to talk about that I find to be a huge issue pertaining specifically to the decentralized model, the adult use cultivators, the product manufacturers like myself, is when it comes to research and development and sampling of our products. Under the medical, everyone had a retail, so it was very easy for you to have a sampling program, whether it was a coupon or a buyback for your staff and employees. Right now, we have no way to do that without it going to a retailer, setting up that sort of buyback program and coupons and that going into Metric. I would ask that the Commission looks at using Metric and setting up some sort of specific code pertaining to these businesses as being, R&D, employee sample, or even vendor sample, allowing the product manufacturer to directly give samples to our employees as well as vendors. That's a huge thing that actually happens in other states. Dispensary managers don't necessarily want to bring a product on their shelf unless they know that the quality and that the product is going to be what it represents on the packaging. Without the ability to offer them samples, a small business like ourselves would be very cumbersome to actually get our product into those stores and be able to offer those vendor samples. So I would ask, where Metric is such a defined tool and we are tracking down to the individual product, that as long as it's tracked in Metric at either the cultivator or the product manufacturer, it could report back to the state that X amount of product was used for sampling. You could also set a limit as to make sure no one abuses that by giving away too much product for sampling purposes. I want to echo a few themes that I heard today. We have very high barriers to entry, and we want to make this an equitable program here in Massachusetts. So continue supporting the local businesses. Thank you for that. The security for the 24/7, that was something that we are dealing with right now. It's extremely expensive to actually house the data. So something that was mentioned before would be the motion sensor. I think that is a great model. I think it cuts down on the storage and the capabilities that we would have to implement, but still be a responsible business owner. The other thing would be the testing. I definitely believe as a product manufacturer, we do have to adhere to the 5 milligram, 100 milligram max. Having that 15 to 20% variance buffer in there has allowed Colorado to be extremely successful, also having a very small restrictive dosage. So I would ask that that is something that's looked at so that we can have some sort of variance in there to ensure that we're getting product to the market in a timely manner. And I think, that is all. So thank you so much for your time, and I'll give back.
Thank you, Angela. Next speaker is Shannon Jones.
She'll be coming back. We're at the bottom.
Okay, I'll come back. Next speaker, Maggie Kinsella. Hey, Maggie.
Hello. Thank you again for putting on these listening sessions and taking feedback from the community. I'm the press secretary for MassCan, the state affiliate for NORML, and MassCan supports social consumption and delivery only and event licensing, specifically because consumers who are still waiting for an area to consume, they don't have that. And they can't use it in their homes if they live in subsidized housing or they rent. And people actually should be paying attention to House Docket 3392, which actually is an act that prevents a public housing tenant from using on the premises for smoking. So something to just kind of keep an eye out for. There are bills in the House right now addressing some of this. Properly regulated, it allows new consumers to ease into cannabis use and gives a safe space for people who are already consuming to therefore go and do so. There's going to be new users who should be educated on consumption methods, different effects that they're going to experience. A single dose serving might not affect a consumer who uses regularly, but a newer user that would be helpful for preventing overconsumption. To talk about the different models, the BYOC model has existed. It's the bring your own cannabis. We've been doing that for a really long time. There are places that are successfully implementing that in the gray market, like Summit Lounge, but it's not a financially viable business if you don't have that mixed use license, that ability to actually have a retail space for product to sell to your members. The San Francisco market currently has a business model where you can attach a lounge to the business, and they use that as far as social equity goes, but it's not very equitable. You're creating a dependency for the applicant on that business. That business then therefore gets to choose who uses that space for that. So it's not the most equitable model. The model that you actually came up with last year, which addressed mixed use licensing and all of those different types of licensing, is going to be the most sustainable. It includes all of those areas of entry. And it's also going to give small farmers an outlet for their products. And we talked yesterday a little bit about home growers being able to bring their excess. But I think it should be stated that there is this over-assumption that the plant count can either produce more or less than what someone's going to consume. And that's a case-by-case basis. And a very experienced, knowledgeable grower with 12 plants can definitely produce more than they might consume. But a newer consumer, a newer grower is not going to have that same capability. And there's also product loss that can happen during that grow period. You have 8 weeks at least of flowering, so it's not including your veg time. If you're taking from clone, seeds take even longer. So there's a lot of variance within that as far as how much product is going to be created at the end of that, just to kind of throw that in there. And then for delivery only, this is really important not just to have it attached to another business. We want people to have their own business model with delivery only. It's private. It can be done at a smaller tier, and that creates access at all levels for different types of delivery businesses. And things like security should match the inventory and the size and the amount of product that they're carrying. If you don't have that much product, your security standards don't necessarily need to reflect that of a standalone business or a dispensary that's already existing. And I went over some of the event licensing yesterday, so I will wrap that up there. Thank you so much.
Appreciate it. Next speaker is Peter Glass. Good afternoon.
Afternoon. Hello. My name is Peter Glantz. I'm a patient who made cannabis tincture for myself after an eye surgery left me in chronic pain. And that led me on a journey here. I've since founded Howell's Tincture, which is a whole plant infused tinctures available to patients throughout Massachusetts in the dispensaries, in the medical dispensaries. And we expect to have it in adult use dispensaries in the coming months. This experience has brought me here today to recommend, for the good of consumers, manufacturers, and small businesses, that tincture should be made its own category in the adult use regulations so there can be consistent long-term clarity for tincture producers and consumers. For context, cannabis was recommended to me as a way to relieve my symptoms after that eye surgery, and I thought that was a joke because I had smoked weed and it was so strong it made me uncomfortable. That couldn't be a medicine or something I could use regularly. But that's when tincture was recommended to me, and I immediately realized that it was different than the other forms of consumption because it allows for precise control over how much to use, and it's low potency. This means you can find the right amount for you, and that's a big reason it's been used around the globe for 5,000 years. In my years of making cannabis tincture for thousands of people, consumers are frequently excited to find this unique way of using cannabis that is an alternative to smoking edibles or concentrates. For this reason, I ask that you use the guidance on tincture you provided in November as a framework to make tincture its own category in the regulations, while clarifying the details that weren't addressed, like how it's tracked in the system. I agree with other speakers that the medical system for tracking works and can be easily used as a model in adult use. By categorizing tincture independently, the CCC will provide tincture consumers, manufacturers, dispensaries, and small businesses like mine clarity we can count on for the long run. This is especially important for myself to provide consistency for adult use consumers and not be subject to whatever variations in the regulations happen with flower or concentrates or edibles. Let's see, in conclusion, by making a tincture a distinct category, you'll be serving the entire community who relies on this uniquely controllable and historic product. And so thank you for your time, and I look forward to working with you on this issue in the coming months.
Thank you, Peter.
Thank you.
Next speaker is Franny Tejeda. Good afternoon.
Good afternoon. Good afternoon, Commissioner, and good afternoon, Commission. Give me 1 second when my phone decides to. So my name is Franny Tejeda. I currently live in Dorchester, and I am working to pursue a microbusiness license with 3 other colleagues, 2 of which are social equity applicants. First of all, I would like to thank the Commission for taking the time to listen to us today and for working towards ensuring equity in the regulations within the Commonwealth. Today I want to talk about the topic of delivery licenses. I asked that the Commission should grant delivery licenses exclusively to economic empowerment and social equity applicants, cooperatives, and micro-businesses as well. This initiative will not only encourage more minority applicants and social equity applicants to apply, but also equalize the playing field within the industry. This will also allow these minority-owned businesses to claim a larger share of the current cannabis market in an industry already dominated by very capital-heavy corporations and entities. This larger market share will allow them to also give back more to the community, really through donations, additional funding for education seminars, and also to materialize their positive impact plan. Allowing us to deliver directly to our consumers will also minimize one of the Commission's current worries, which is driving under the influence, or the and delivery licenses will minimize that temptation of after receiving or buying your products from the dispensaries, getting back in the car, and once you're safe, lighting up or eating any edibles. And that would be something that will reduce that risk for the police officers, but also others on the road. I also asked that the Commission consider the safety of these delivery vehicles as one of the priorities to protect the RMDs that will be delivering the products. As we know that this industry stemmed from a lot of violence in the past. And that is all for today. Thank you for your time.
Thanks, Franny. Next speaker is Andrea Van Ween. We'll come back. Matthew Frost. Good afternoon.
Good afternoon. Thank you, Commission. So my name is Matthew Frost. I'm a Boston native, and I represent Anna as the founder and CEO of the company. Anna is the first retail automation solution for cannabis dispensaries. It's a speedy self-checkout assistant for cannabis staff. Excuse me. Anna provides the autonomy of self-checkout while preserving the oversight and control needed of a licensed bud tender and dispensary. For customers, Anna educates consumers on safe consumption and purchase limits and improves access with its efficiency. For dispensaries, Anna creates jobs, increases throughput, increases fulfillment compliance, reduces human error, and decreases local traffic issues. Anna meets or exceeds all applicable MGL 94G regulations, particularly around the responsibilities of dispensary agents, product access, security and visibility, and product storage. Despite the fact that Anna appears compliant with existing regs, a number of our potential retail partners seek greater certainty with regards to the technology from the Commission. We are therefore seeking either a clarifying provision in the regs or a clarifying statement from the Commission. This would be along the lines of what the MED, the Marijuana Enforcement Division of Colorado, does by issuing statements of position and industry bulletins on these kinds of matters. We appreciate your time and consideration.
Thank you very much. Next speaker is Enid Pope. Good afternoon.
Hi, good afternoon. Hi, Commissioners. My name is Enid Pope, and I am an economic empowerment applicant. I wanted to speak with you guys just to express my concern about the status that we have and how it seems like it's possible that it could be diminished. I've used my status to help open doors for myself as a Black woman. I've been picking up every single breadcrumb that I could find to either open doors to talk to people in Massachusetts or outside of the state. The whole process has been extremely daunting and challenging. And it does make me very concerned for people who also have this designation and may not have the time or even the tenacity to keep talking to people when you get no's or you get discouraged. I'm a very hard-headed person, so I keep going. The application that I submitted documented my work professionally and personally to improve lives of disproportionately impacted communities. This has been my work, and this has also been how I was raised in terms of giving back to communities. So with or without a cannabis license, my work to improve communities and situations for Black Americans will continue. And excuse me, I'm a little nervous. It's been interesting to hear the applications that have been approved for licenses, because so many of them mention economic empowerment applicants. Yet I have not heard of any of the programs that they're doing. I'm not familiar with their initiatives or how they actually intend to incorporate us into what they're doing. This is frustrating because as an economic empowerment applicant, we have committed to doing things to impact communities, and also we have gone on record to say that we have worked in these communities at some point. I feel like there are a couple of things that I can recommend, and I don't know whether or not it's within your scope. But one is to create much more of a focus on economic empowerment applicants. There were 120 people or so who were approved. Since last year, we've only seen 5 applications. There are a lot of false narratives that I've seen. One that I've read recently in an NPR article that said African Americans do not want to work in this industry. I've not seen that. I haven't seen it at all. So there's no true roadmap for entering cannabis, but I believe that this is something that we can do, and with some support, some incentives to encourage some involvement, investment in people who are like me, that would be very helpful. So my recommendations, as I said, it may or may not be within the scope. Focus on the EEA applicants, the 120 currently exist. Explore creative solutions to incentivize companies to work with economic empowerment applicants. Separate economic empowerment from social equity. I believe the goals and objectives are 2 separate things. One was very clear in terms of ownership, and that was something that was reinforced when the application period for EEA exists. With social equity, it creates this umbrella. And not all of us, especially myself, I do not qualify for social equity. I haven't lived in Boston that long, and I don't live in an area of disproportionate impact. Bay Village doesn't count. And I'm also in a household that makes over the 400% below poverty level. And just to make sure people are aware of what that means, I'm in a 2-person household. So technically, that would be a household for 2 people at about $65,000 or $60,000 a year, when the average salary in Boston is over 70. So that's, to me, I just don't think that that's something that, I think it will leave a lot of people out. And it will leave a lot of people who I think should have a place and a role in this industry. The next piece was, oh, okay, good, I'm almost done. So the next piece is, I think there needs to be an EEA presence on your advisory committees. So I do see that there are a number of people, but not one person represents this group, or can even speak to social equity at all. So I think that that's important. And I also suggest dedicating a staff specifically to work on economic empowerment applicants. And that means work with us directly because our needs are going to be different from those that fall under the umbrella of social equity. On top of that, I feel like that person should be in a role and should hold companies that are approved for licenses, saying that they're helping economic empowerment applicants, hold them accountable. So that's it.
Thank you very much, Edith.
Thank you.
Next speaker is Stephen Manley, and accompanied by Sid the dog. If you guys haven't met Sid, Sid is the gentlest dog that has ever walked the face of the earth, and I know dogs.
Not too bad. How are you?
Well, thanks.
Come here.
Hey, Sid.
Down, bud. Come on, I know your buddies are here. Thank you for hearing everyone today and myself as well. I'm here to speak about things that we have spoken with privately, and I would like to speak about it publicly and see if we can get the ball rolling on some of these issues. I've spoken before for veterans and people with disabilities, and about how there's other states with medical programs that are doing a lot more to address the issues for a lot of veterans in the, as Commissioner Titles said a few weeks ago, the redundancy of becoming a patient for a lot of veterans. The state of Illinois, which has closer to 800,000 veterans, well, we have 300,000. They also have 86,000 disabled veterans using the VA, as we have 65,000 here using the VA. So the work is not even as great as it is there, and we could be making movements on having a program set up for these veterans with disabilities that will cost through service, and a lot of them that are not going away. So currently the process for becoming a patient is a barrier for a lot of them, where we go to a doctor, we have federal paperwork, myself included, have disabilities and problems that are noted by the government as permanent and total, which means they are degenerative, not going away. Yet each year, I'm sent an email and have to go back to see another doctor to talk about problems that have only gotten worse. The screws and the rods in my spine are not coming out. The dead brain matter on my brain is not going to grow back. Yet I still have to keep going back year after year for these, for a referral for medication that is far less dangerous than the other 57 medications that I took previously for the last decade. I fall into the same boat with a lot of other people with disabilities. There's roughly 190,000 Massachusetts residents that are on Social Security disability income. Those are, again, people that are on fixed incomes that really can't afford to go see another doctor on top of what they're already seeing, and pay for more medications that their Medicare and Medicaid is not going to cover. So we'd just like to see if we could come up with some sort of timeline on when we're going to be able to help these people that need this medicine the most, and just really keep moving the ball forward and taking care of people with compassion and giving them a less dangerous, less toxic, more life-improving medicine in cannabis. So thank you.
Thank you, Steve. Next speaker is Raj Tarmanian. How badly did I do on your name?
Pretty good. You can call me Chachi, though. Call me Chachi. How's it going?
Good afternoon, how you doing?
Pretty good. Thank you for hearing me today. I am what I would like to refer to as a small-time grower. I grow personally for myself. I'm also a photographer and board member for MassCan, starting this year. And I just want to address event licensing and how it could help people that aren't in the position to be spending thousands of dollars on space or whatever it is they might have to spend on. It gives people like me and others the opportunity to go to an event and display things that we take pride in and offer it for a reasonable donation or cost, because it does take money to grow cannabis. I mean, we can all grow cannabis freely outside under the very strict means of just sun and water, but some of us go a little beyond and above. Electricity, air conditioning, all those little things that slowly add up. And as it is now, I mean, we're supposed to give away this medicine that took us months of time to grow and cost for free, but there's no, I mean, it's cool to be able to do that, and I would love to do that more, but as it's currently situated, you can't just do that and continue to run that operation. So anything to allow people like me to be able to go to an event with proper lab testing, whatever is required. You know, I would like to give the state my money and not be called a criminal. It's very difficult. I live with an immigrant Lebanese mother who looks very downly upon cannabis, and if we got laws to make it available for people like me to take part in the industry, then I think we could change the social stigma of old school people who don't think that anything that we're doing is legal or illegal. That's basically it. Thank you.
Very much. Appreciate it. Next speaker is Warren Khalil. And that. Next speaker is Jason Woodley.
Thanks for having me back, guys. 5 minutes on the clock, I know the drill.
Yeah, you did that yesterday.
I know we spoke briefly yesterday. We'll talk a little bit more today about social establishments and delivery services. So before I get started, me and Chairman Hoffman got to speak briefly yesterday, and something actually resonated with me that Chairman Hoffman said. He says, our jobs here on the commission is a balancing act. It's really to balance a lot of different viewpoints here in the community, both safety officers, us here, corporations, so on and so forth. So took some time last night to come up with some thoughtful recommendations around social establishments and deliveries. This is in regards to the CAB meeting that took place on January 11th, so a lot of these are in regards to that. There's a lot of discussion on edible use in social establishments in general. A recommendation to meet both the populace demand to have these facilities come out in a timely manner, but also to balance the concerns of health officials and public safety concerns, would be for the CCC to roll out social establishments in 2 phases. First, establish laws for social establishments just using cannabis in its concentrate and flower forms. And then after this has been established, and more time to create sensible laws for edibles, roll edible use into social establishments at a later time. Concerns I have with edible consumption, and I know the CAB meeting on January 11th did as well, is delivery vessels, standards around home delivery, such as like food delivery services or pizza delivery, what the standard dose is for an edible. I have about 30 bullet points here. I'm not going to go through them all in 5 minutes, but I will email them to you afterwards.
Thank you.
So because there's so many items, because there is so many items that need clarification around edibles and less items that need clarity around social consumption of cannabis in its flower and concentrate form, I would make this recommendation to the board around a 2-stage rollout. This could be facilitated one of 2 different ways. Either option 1, with 2 different categories for social establishment licensing, or you could allow all uses of cannabis consumption with a single social establishment license, but put a moratorium or a halt status on serving of edibles under the social establishment license till a later date when sensible laws are formed. In regards to delivery systems, I would make the following recommendations to the board. First and foremost, I feel the biggest deterrent to delivery theft is a Know Your Customer program. Similar to those used in banking systems, clients should be required to sign up with a designated delivery service providing demographic information such as name, date of birth for age verification purposes, home address, phone, and valid picture or ID like you would require for a liquor sales. This information should be stored on a secure database that would allow drivers to visually see a client at delivery and then be able to match the profile picture on the database with said individual. With the technology we have currently available even today, this can be easily facilitated by as little technology for smaller startups as a secured computer system and cell phones. By utilizing a system like this, it would also make it relatively easy to pass information over to law enforcement officers if an incident were to occur, which honestly I feel is a better option than requiring delivery drivers to be armed or have an armed secondary driver. A second major deterrent to theft the board should consider is locked compartments and/or locked center consoles for delivery vehicles in addition to GPS tracking. These, once again, can be easily installed into delivery vehicles, allowing drivers to have a safe and secure area in vehicles to lock products while en route to customers. In regards to GPS tracking, by having these installed in vehicles, a centralized dispatcher will know where any driver is during any time out on their deliveries. Once again, all these things could be